Today in the lab, a topic that's on the minds of lots of parents, autism.
Today's show is brought to you by Baby Bjorn, baby carriers that are Ecotech certified and safe for your baby. Baby Bjorn.
To get a better understanding of this condition, we went and talked to the committed folks over at the Central Texas Autism Center.
Autism is a spectrum disorder. It's a neurological disorder, and it manifests as a behavioral disorder, and so it manifests itself in deficits of communication, behavior, and socialization. Right now, the latest statistics are 1 in 150 births will be affected with an autism spectrum disorder, and 4 out of 5 of those births will be male. There is currently no biological test or markers or blood test that you can get. It's pretty much just typically caregivers and parents being really good observers. Typically by 12 months, if we're seeing any delays in the children making eye contact, pointing and gesturing towards things of interest, any delay in babbling, or if you see any regression in those skills. Do they engage in typical kind of play behaviors? Are they real rigid in their behavior? Or do what we call stereotypical play? So do they line up their toys instead of playing with toys in a typical manner? Some kids will develop more typically, and it's not until a little bit later on when we get them in more social settings that we start to see an impairment in the ability to make friends, the ability to sustain a conversation. Sometimes we might see an over-focus of, we call it a perseverating on certain topics. So the child might be able to know everything about dinosaurs and be able to have a full conversation or narrate to you everything about dinosaurs, but won't be able to have that reciprocal exchange where they're asking questions or being able to dialogue about different things. If families suspect that their child may have an autism spectrum disorder, the first step is to go to their pediatrician. Pediatricians should be screening for this with a screening tool called the MCHAT. Every state has an early childhood intervention agency that will provide from the state level resources to start therapy. That could be speech and language pathology, that could be contacting with an occupational therapist or a behavior analyst. To find a service provider that does applied behavior analysis therapy, you can go to the BACB.com, which is the Behavior Analyst Certification Board, and find a board-certified behavior analyst in your state or your area. In applied behavior analysis, we're going to do an assessment and figure out the function of your behavior. So we look at, because typically of a lack of communication skills, they're engaging in problem behavior to communicate. So if you can't get the language to get your wants and needs met to request milk when you want it, you could learn to scream for milk, and that works pretty well. So that's the first step, is to analyze, and that's part of what applied behavior analysis and a board-certified behavior analyst would do for you, is help you to analyze and figure out why your child is doing some of the behaviors that they're doing, and then we treat the function and not just the form. So we'll develop a behavior treatment plan that will help reduce those challenging behaviors, and at the same time we'll be teaching replacement behaviors, and oftentimes that's language therapy.
Man, as a dad who hasn't had to deal with this, I can't imagine what the families that are coping with autism go through.
And it's tough that this community has been divided by controversy. Of course, I'm speaking about Andrew Wakefield, whose report in the journal Lancet linked the MMR vaccine with autism. Of course, Lancet later retracted that article, and Wakefield lost his license to practice medicine.
That's Jenny McCarthy's dude, right?
Yes, it is, and it's very obvious that passions run very high on this guy and this subject, and we want to hear from you. Drop a comment on this video or join the conversation at dadlabs.com. Has autism touched your life? Do you have thoughts on the controversy? Let us know. You'll hear back from us.
I'd like to thank our sponsor, Baby Bjorn, Architect Certified, safe for your baby, Baby Bjorn. Well, that's all for us here at the lab. We'll see you next time.